So you've all seen the ATI video. You've all heard this before. And every nurse is going to do something a little bit differently. And so you're probably going to see me do some different things than you saw in the ATI. But the idea is maintaining sterility at all times. Okay? But the joy of doing this on a mannequin is, number one, you're not going to get the sounds, you're not going to get the smells, and you're not going to get the sputum. Because this is noisy. And I could try and do the gurgling for you, but it's nothing like what you're going to actually experience when you deal with a trach patient. And if you dealt with a trach patient and you were to touch their trach, they're going to spute. So the last thing I'm going to do is put on the dressing around their trach. Okay? So I've assessed their lungs, I've washed my hands, I've put on my PPE, I've explained the procedure, and now I'm going to check on my suction machine. I've also brought in some saline, and at this point it's sterile, it's a brand new bottle, and I've got my hydrogen peroxide, so everything I need I've gathered. So I'm going to test the suction machine, and it does in fact work. Okay? And I like to keep my tubing right here, because once you set up your sterile field, you don't want to turn your back to it. Okay, so here we go. So I open this container. I really do not like these containers because they don't give you that 1-inch feel that I need. And I tend to don my gloves differently than some people say. The textbooks say don your dominant hand first. I want to open this, put my lid up, and on my gloves. Now I can play around here. Okay, so I've got my lovely little handy dandy suctioning box. So now I'm going to commit. I keep my hand that I'm going to keep sterile in a mitt that helps me to remember not to move it to touch anything. So I'm going to go ahead and pour my sterile saline into my box. I'm going to grab my suction catheter. Now you think, okay, I've got it with my non-sterile hand now, right? Doesn't matter, because what matters is that this is going to go into my hand. Oh yeah, you're going to be difficult. And I'm going to connect the two, keeping this hand far enough away from here. This is the part that's going to be important. Okay? I'm going to check my suction first to make sure it's going to work. Okay? Down goes. Down, 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 down. No suction. Going down. Okay? And you just want to go down, and when you come back up, no longer than 10 or 15 seconds, do a little twist with full suction on or intermittent suction, and keep your catheter. Okay? Now that's in essence trach suctioning. I like to personally keep this, pull this over my suction cannula and keep that then close, just in case I should need it while I'm cleaning. Okay? I can go ahead now, turn that off, and that's basically suctioning. Simple, especially on a mess mannequin here. I'm going to go ahead and give her a little bit of oxygen back while I'm getting ready now to do the trach cleaning. Okay? Most places now are carrying basically disposable inner cannulas because it's just a lot easier, especially if somebody is at home. They take the inner cannula out, they throw it away. They don't have to deal with all this, but of course there's always the people that like to be using reusable cannulas. So I'm going to let her have some oxygen while I open up my, again, sterile field. Now I love this because they put a nice tray in here, and there's 3 basic containers. So I'm going to go ahead and open my peroxide, open my saline, remove the mask here. I'm going to go ahead now, again, reach in here. These things love to stick together. Makes for a lovely mess. Just remember, we can only touch that one cuff. So now we managed to put some sterile gloves on. Now we've got in here a lovely little sterile drape. Now this sterile drape, of course, I can play with all I want, but when I want to go to put it onto the patient, and I'm going to kind of turn my back to you for just a second here, I like to wrap it around like this. You see how it holds my hands in? Mm-hmm. Just like that, and lay it down. Then I don't have to worry about my hands touching the blankets or anything, okay? I'm going to gather my equipment. I can play all I want in here now. It's an old trach tie. The new ones are nicer. It's a lovely trach dressing, and you'll notice that it's sewed right here so that no fragments or frays get on there. And I'm just going to actually leave this here and set that right there. I've got these. These are going to be for cleaning. So I'm going to actually separate these and stick these in this little separate container right here. And you'll notice I kind of keep my arms tight to my chest. That reminds me not to reach over. Okay, I've got my scrub brush, and I've got my 4 little pipe cleaners. Now I again have to commit a hand. So I'm going to wrap this fist here. I'm going to fill this part with part hydrogen peroxide, 50% hydrogen peroxide, and 50% normal saline. I'm going to fill my other 2 with just normal saline because I don't want to use normal saline or hydrogen peroxide actually on a person's skin. Okay? Now with this hand committed still, I'm going to reach over because there's nothing sterile about this outside or top white part of the cannula. And I'm just going to dump it into my cleaning agent. Now, again, because this is a mannequin, you're not seeing all the bubbling and the goop that's sitting in there, and this is kind of frothing all over the place because that cannula is full of sputum. At this point, I like to take just one of my Q-tips. Not that one. Anybody know why?
Because that's not your
I
standard.
just contaminated it, so I need to take this Q-tip. And all I need to do really is to clean this little round here. I don't really want to go down into the trach. I'm just cleaning kind of the rim. Okay? And then I'm just going to drop that into my trash. Okay? Now as this is soaked, again I have to think, sterile, non-sterile. I reach into this cleaning supply and I pick up the trach by the white piece here. Okay? And then I pick up my brush, and believe you me, in here, you're not going to have a fond appreciation for it. But if you can imagine right now, as I go down, sputum is hanging off of here, and sometimes it gets pretty thick, and you have to do a little scrub job to get it out. Okay? That's clean now. But I can't put it back in, and I just contaminated my finger. I can't put it back in because it's got hydrogen peroxide on it. So I'm just going to set it over here, and I'm going to do a nice little wrench job. Again, remember, I can hold onto this white thing all I want. I just can't touch this piece. So once I've got this all rinsed out, I can kind of dry out the inside and then basically get rid of that. Come over to my patient. Put it in sideways, kind of just come up, and it just should slide right down and lock it, okay? At this point now, you might say, well, why didn't you do your dressings and stuff? Well, at this point, really, is sterile really that terribly important? Not really, because I'm going to touch the outside. The sterile part is really completed now. So I'm going to pull this dressing down, and I'm going to throw it in my trash. Now I'm going to use, you'll notice I kept my hand though pretty sterile, right? Because I don't, even though it's not a tremendously whole, totally sterile procedure, I don't want it to be dirty either. I'll just leave that one there, I don't need that. And I'm going to keep those in my hand. Okay. Transfer them to there. Now what I need to do is basically to clean the skin underneath. So I'm going to swipe it down once, put it in my trash. I'm going to take another one, come down and swipe it again, get rid of it, and one more around the top. Okay. Now I could dry that if I needed to, but now what I'm going to do is finally, lastly, take the dressing. And the piece that I want to take, and I'm going to kind of take it down here a little ways, because the piece that I want to put up, I want to keep this piece as clean and away from my fingers as possible, okay? I'm going to take this, I'm going to stick it here, and I'm just going to bring it right underneath this nice trach tie, okay? Don't want to go over top of it because inadvertently my arm could go across and then they're going to be shaking and saying, hey, I need to breathe, I need to breathe. Really the whole purpose for this dressing underneath here is to keep this flange, this trach flange, off of the patient's skin, okay? And then of course I could change my trach ties. Now, when you change your trach ties, you only want to let go of one side at a time, because if you took them both off, they give a cough, they're gonna send that trach clear across the room. So you redo your new ties, and these are the new fancy ones. These are the older ones, not nice. If you do use these though, you want to make sure that when you put the ties on, that you tie it so it's on the side. And you want to make sure that you leave a little bit room so that the trach isn't too tight. Now over here, this trach is actually, or this tie, is actually a little too loose because this has too much play to it. So you want to have it a little bit tighter. Oftentimes we end up cutting these to size. And that in essence is trach cleaning. Pretty easy.